Neurodegeneration is something else we see in dysbiosis. Dysbiosis contributes to leaky gut, we already established that, which allows bacterial toxins, especially LPS or lipopolysaccharides, to enter the bloodstream. Inflammatory cytokines, these are inflammatory chemicals, move across the blood-brain barrier and activate the brain's immune system and the microglia in the brain's immune system, causing neuroinflammation. So the leaky gut, the junk gets into the system, crosses the blood-brain barrier, the microglia jump into action because they're like, this ain't supposed to be here, and then we start seeing neuroinflammation. Chronic neuroinflammation triggers accumulation of misfolded toxic proteins that kill neurons, but it's site-specific. Interestingly, it's not just everywhere. Where do we see these neurons being killed and these misfolded proteins ending up? The three places we really don't want, well, there's a lot of places we don't want them. The hippocampus and the amygdala, two areas that are involved in emotional processing, and the prefrontal cortex, the area involved in executive functioning. We really don't want to see shrinkage in these areas and accumulation of toxic proteins. So again, if you're working with somebody who's got brain fog, cognitive slowing, even diagnoses like Parkinson's, dementia, or Alzheimer's, yes, changing the gut microbiome is not going to fix that. However, if the microbiome is out of whack and contributing to this neuroinflammation, contributing to leaky gut, then their condition is likely going to progress more quickly. So we can help mitigate what's going on in their body. Emotional symptoms of dysbiosis, anger and anxiety. Well, guess what? That makes sense. When we've got inflammation, when our gut is out of balance, it's not doing what it's supposed to, it triggers the stress response, which puts us on high alert, which means we are more likely to respond with anger or anxiety. We're likely to respond to most anything as if it's some sort of a threat. Dysbiotic gut bacteria alter vagal signaling, sending stress signals to the amygdala and the hippocampus. So basically, these gut bacteria kind of shut down our parasympathetic nervous system and say, nope, we got stress going on here. Leaky gut triggers inflammatory signaling, which triggers the stress response. And leaky gut and errant vagal signaling cause sympathetic dominance. So when you've got this leaky gut, which doesn't just happen for an hour and then go away, this is something that is a chronic condition for a lot of people, especially if they've had chronic stress. Then they've also got errant vagal signaling. So their brain is perceiving things in the environment as a threat when maybe they're neutral. This causes us to stay in sympathetic activation, stay in fight or flight, so the sympathetic nervous system becomes dominant and the parasympathetic nervous system becomes muted. What happens to people's emotions when we see that? We oftentimes have people who are very, very anxious and or go into that state of flat to furious and dysregulate. They may just barely be getting along most of the day, but when they're triggered, oh boy, are they triggered. Dysbiosis also disrupts the brain's dopaminergic system and its ability to assign value to rewarding activities. So when we've got dysbiosis, things that normally would make us happy, not so much. It's just blah. It's all kind of gray. This is something we hear a lot in early recovery from addiction, for example, because their dopaminergic system just isn't working very well. And for most of them, their microbiome's out of whack. Their brain is having difficulty assigning positive value to rewarding activities. Things that normally would be rewarding just don't kind of make it.